Local organization is taking steps to reduce opioid drug overdoses in our area.
Now, the Sullivan County Anti-Drug Coalition got a grant from the state to bring some training and also to help with the distribution of the opioid overdose drug called naloxone to the region. Elizabeth Kubel's live tonight. She spoke with coalition officials today. They're hopeful this is going to help to save some lives and get naloxone into the hands of anybody who needs it.
That's right, Josh. The grant is called the State Targeted Response Grant, and because of it, officials at the Sullivan County Anti-Drug Coalition tell me that this will be the first time that that overdose drug naloxone will be widely available to the community. Now, if you're not familiar, that's the drug that's administered before people who are suffering from an overdose are taken to the hospital.
I don't think a parent could ever forget that moment.
That moment nearly 2 years ago when Rhonda Coffey lost her 33-year-old son David to addiction.
He was very talented, very bright, and he was destroyed by this disease.
She spent the days since advocating for addiction awareness, including the power of the drug naloxone.
That can save a life in a minute. It could have saved his life.
And now the drug will become more widely available to our region thanks to a new grant from the Tennessee Department of Mental Health and Substance Abuse Services.
But what it will do is get naloxone into the hands of people trained to administer it.
Which can include who?
Anyone. Anyone who thinks they have a need for having naloxone available.
McCaffrey says, according to the State Department of Health, Sullivan County alone saw 44 overdose opioid deaths in 2014 and 35 in 2015. Numbers she hopes to soon see decrease.
Getting the naloxone into the hands of people that need it is the critical piece. People are dying. This can save lives.
Now, the grant also calls for a new position to join the Sullivan County Anti-Drug Coalition. That's a regional overdose prevention specialist. And Alice McCaffrey at the coalition hopes to get a full-time nurse and someone preferably who has experience with addiction, whether that person is themselves in recovery or has a close family member that has struggled with the disease. Now, that nurse's job will be to both train and distribute the drug naloxone. Live in Johnson City, Elizabeth Kubel, News Channel 11 in your corner.
Elizabeth, thanks. Now, the Sullivan County Anti-Drug Coalition is taking applications for that position through July 7th. The grant takes effect July 1st.